Today I'd like to talk about some of the various techniques that we use to perform facelift surgery. There are multiple techniques that have been described in the literature that get excellent results. Most experienced facelift surgeons have probably tried most, if not all, of these techniques and may use variations on these techniques depending on the anatomy and goals of the patient and the experience and preference of the surgeon. However, all properly performed facelift procedures employ some basic common principles. First, there's a variable length incision that begins in the hairline in front of the ear, then comes down the natural crease in front of the upper part of the ear. The incision may then go inside the ear behind the tragus in front of the ear canal, or may come in the natural crease in front of the tragus depending on the surgeon's preference. The incision then comes in the natural crease around the earlobe, then up the back of the ear and across and down the hairline to a variable length depending on the needs of the patient. In addition, there may be a small incision in the natural crease under the chin that allows access to the midline of the neck. These incisions allow us to separate the skin from the deeper tissues in the face and neck, creating what's called a skin flap. This allows access to the deeper tissues, which in the face is called the SMAS and in the neck is called the platysma muscle. It's these deeper tissues that we lift and reposition in facelift surgery to achieve a more youthful contour of the lower face and neck. Once these tissues are lifted and repositioned, we have extra skin that comes back with us that we trim away along the incisions around the ear and hairline. The various techniques are distinguished by how the deeper tissues are lifted and repositioned. The simplest type of facelift is called a SMAS plication lift. That's where the SMAS is lifted onto itself to a more youthful position and then sutured in that more youthful position. The next type of facelift is called a SMAS imbrication lift. That's where a strip of SMAS is excised along with part of the platysma muscle, and then the SMAS is lifted from point A to point B and sutured in a more youthful position. We then get into what are called deep plane facelift techniques. Deep plane techniques involve dissection underneath the SMAS in the face and the platysma muscle in the neck, releasing ligamentous attachments in the face and neck that allow additional mobilization of those deeper tissues. A composite lift is traditionally what's considered a deep plane facelift, where a short skin flap is elevated and then dissection proceeds deep to the SMAS, leaving the skin and the SMAS attached in a composite flap as they're lifted and repositioned in a single unified vector. Dual plane techniques are also considered deep plane facelift techniques. That's where a longer skin flap is elevated and then a separate SMAS flap is elevated so that the SMAS can be lifted and repositioned in an independent vector from the skin. The different techniques all have pros and cons, and the preference of technique is going to be determined by the patient's anatomy and goals and the experience and preference of the surgeon. We'll talk more in later videos about some of the pros and cons of these techniques, and also the evidence that may or may not exist in the literature to support one technique over another. I hope this information is helpful.